Well, I think the surgeon needs to be absolutely open to the patient about what are the risks and complications. Surgery is risky business. In good hands, the risks are less, but some patients have particular medical problems that need to be taken into account that might make the surgery more risky. For instance, if they have some sort of a bleeding tendency or a clotting tendency. So I spend almost half the time during my consultation after I've evaluated things, evaluated the patient and what's best for her. I go through the potential risks of complications, and I first of all go through the general risks of complications, things like bleeding, infection, scarring, the anaesthetic, blood clots, and so forth. And then I moved on to specific risks of breast implants. So the sort of things that I talk about there, I talk about asymmetry, the breast not being exactly the same. I talk about loss of nipple sensation. I go into capsular contracture in great detail. And then I talk about, are there any risks of cancer with breast implants? And of course we now know that there is new information about a particular type of cancer called ALCL, which is extraordinarily rare, but it has been associated with breast implants. So I talk about that in detail, and so the patients can weigh up as to whether it's something for them. And then finally I talk about implant rupture or failure, and I do emphasise to patients, like any implant surgery, be it a cardiac pacemaker, be it an artificial joint, implants do have a lifespan, and it's very hard to quantify it because it'll vary from patient to patient, but they do need to understand that sometime down the track they will probably need surgery to replace the implant or correct a problem or remove the implant and so forth. So that time spent in the consultation I think is really worthwhile, and I find my patients go away thinking, gee, that was a really in-depth complication and in-depth consultation, and I've got all the information that I know that I can get to make a decision for myself. And of course there's no pressure, it's a patient decision, it's up to her.